afternoon, everybody. Welcome to our World Hour of Power here with Lady Pauline and my co-host, Mr. Glenn Greenwich. How you doing, Glenn?
I'm doing good. I'm doing well. I am
Bo-
enjoying the the opportunity that the coronavirus is providing us in terms of um, rest, meditation,
uh-huh,
relaxation, spending time with family,
uh-huh.
like that.
Oh, that's nice. I'm bored to death with family. And they're bored to death with me, so I can't wait for all this to be over and we can get back to normal. But being that we live in the same community, I wanted to ask you because you're closer to the app than I am. I wanted to know what's going on Southern Boulevard around your area.
Right now, Sutphin Boulevard is still somewhat busy, but of course, got to remember it's a hub. And so, because it's a hub, um, it's still some activity there. Still people um, waiting for the bus, waiting for the train, so forth, buying their fish.
Okay.
The fish store was open up until yesterday, at least. Um, so there's still some activity.
Now, what about not the Long Island Railroad, but the air train? How is that working out? Because didn't they stop some planes from coming in? So is there still that type of traffic for the?
Well, they didn't stop all the planes,
Okay.
and you still have domestic flights also that haven't. Well, I was getting ready to say that they haven't been effective, but the truth is that um, that they've reduced their flights.
Oh,
Um, so it's less traffic, but it's still open. It's still open and still available. Um,
because
Hi, we just been joined. 646
Yeah,
2962. Please
that's me,
introduce
Baron.
yourself. Who's this?
It's me, Baron, Glenn.
Oh, hey. Hey,
hey,
Baron.
Baron.
Hey, right,
You guys
right.
remember him?
Thanks
He
for
was on
inviting
the
me.
show. He was on the show earlier.
Oh, okay. How you
The
doing?
financial
Oh, the
piece.
financial piece. Okay,
Right, right,
I
right. So how
remember.
you
Right.
doing, brother?
What's go?
God is good. God is great all the time.
That is true.
You know, and
That is
and
true.
and and, and, and yourselves as well.
Good. Very good. Hanging
Okay.
in there. The family, family's good. Um, and we're doing what we can.
How's the financial business going so
Oh
far?
well, you know something. Believe it or not, we have a lot of people that's coming to my company because so many people are out of work today.
Yeah.
And so I can't mention the name of my company because they prohibit us from advertising, so I can't mention it on the air.
Okay, I
But
understand.
but to join my company, you just pay $49. You get your $49 back, and we have bonuses for people for whatever that they do and so on and so forth. And how they perform. We uh we offer if I remember if you remember before, we offer five city, state, and federal licenses that the company would pay for. Okay, uh, and so a lot of people have come to our company because they're looking for alternative means of income.
Are you able to
Okay,
mention what those licenses are?
okay, the life insurance,
Hmm.
life license, Series 6, 63, 25, and 23. Those are investment licenses. And the
Yeah,
reason why, not that
mutual
you
funds,
remember, Glenn?
mutual funds,
Right.
stocks, bonds, etc. So those
Annuities.
license annuities as well.
Right.
Yeah.
Right. And for me to talk about those licenses to anybody, or to talk about those products, I should say, I would have to be licensed. Not that I would become an expert stockbroker or an investment advisor or financial investment advisor, but just for me to talk about them with you, I would have to be licensed. And then what I would do is, if you decide you want to invest, I will get you over to like Legg Mason. Is an investment company. It is one of our investment companies. I'll get you over to them, and then they will take it from that point on. You see, but the company wants us to be licensed just to even talk about those things.
Okay,
Yeah,
I
yeah, you
understand.
really have to be. Absolutely. I want to welcome Michelle to the call. Hi, Michelle.
Hey Glenn, how are you?
Hi,
I'm good. I'm
Michelle.
good.
Hi.
How's it going? How's your family and yourself? Keeping safe?
We all blessed. We just keep it focused on good Lord.
Absolutely. Absolutely.
Is
Well, go ahead, lady.
are you working from home, or you just
Yes. Oh, me? Are you speaking to me?
to Michelle?
Oh,
Yes.
oh.
Oh, you
Well,
are.
I have like a landscaping, so I don't have to really be dealing with people. I just work outside when the weather starts getting warmer.
Okay. So you haven't have you seen any difference in revenue as far as the businesses that you represent and what you've been doing?
No, not for me because I'm still getting it off the ground. But it I won't know until really going into next month. If people want to hold on to their money, or they're still willing to pay
Hmm.
for the services.
Hmm. Okay, that's good to know. Um,
Yeah, just so folks know that there are um, SBS has a couple of a grant and a loan fund. The grant is for employee retention. So if you know of any businesses that have lost employees or had to lay off their employees, this is some money to retain the employees. So that's a grant. And then there's a continuation or continuance loan that is very low interest that SBS is making available again to small businesses. So businesses of five and less people um, who who need a little something to capture or to at least help them get to when we get back to normal. Although I don't think we're actually going to be back to normal. I think that this change is actually going to be a change that will continue going forward, just like 9/11 was. There were
Yeah,
certain changes that were made, and we now live a different life because of that. And so I know that out of this, we're going to also live a different life as well.
yeah, it was
yeah,
going to be like a new world, as they said, because a
Yeah.
lot of things is going to be implemented that wasn't implemented before.
Yeah,
So,
and I think that we really have an opportunity to look at ourselves, our lives, and to look at really what our purpose is. What are we waking up to do? What am I here to do on the planet? Um, you know, um, it's a time of reflection. I was just got off another call, conference call, and a good friend of mine, what he shared was that the world is going through maintenance. Sometimes when you can't get into the computer, um, it it says not available for maintenance.
mhm.
So the world is going through some maintenance now. It's things are shut down. People are looking at things or forced to look at things a little differently, and so as a result of that, um, there will be some major changes that are occurring. Sonora, welcome to the call.
Thank you.
Good afternoon,
How are you?
Sonora. How are you?
Well, how are you, my dear?
I'm doing good.
Good.
Good, 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 good. So how are you and your family doing in all of this, Sonora?
It's a little stressful, but we're well, thank God. Just, a struggle trying to work from home and trying to do things that you normally did with paper and pencil online now. So that's just been a big learning curve for me, but it's working out.
Oh,
Okay.
good, good. Yeah, that's part of what we were just talking about is that things are changing. We're at the end of this. There will be major changes that we'll do in terms of how business is done, possibly how education is even done. Who knows? Um, Although I think that there's something about the face to face that you need in education, but the fact that people now have, or well, not all people, but some people have the opportunity to just be able to um, go
Work
online
and
and
work
go
from
work
home.
from home. Uh,
I feel very bad for the children because it's terrible to be hemmed up in the house, and a lot of times people don't have enough activities to keep them engaged. Besides the schoolwork and the online that they have to do, it's nothing like being around people. And I
I,
think that's driving a lot of people crazy right now.
yeah, and as a teacher, Sonora, I think that people are going to recognize what it takes to be a teacher, having their kids at home with them 24/7. I think that that's something that I know a few teachers, and I know some of the challenges that they've had in teaching and getting supplies and so forth, that they would have to spend their own money to do, and so I know that it's challenging. You're underpaid and overworked, as a lot of other areas, but I think that my affinity with teaching specifically is that you're really bringing up the next couple of generations, and that is in itself, I think, a very important role in society that I think is neglected, and it's not just neglected in this country, but I think in this country, I think we really do a disservice to teachers, and so I think that there may be some changes. Hopefully, there's some changes coming down the pike as a result of this that recognize the contribution and the talent that our teachers really provide our young people.
Miss Brown, what ages are the children that you teach, or are they adults?
I teach high school 9, 10, 11, and 12,
Okay.
mostly seniors though.
Okay. Now they had said that the kids was going to be able to get computers or laptops. Has that panned out yet?
Miraculously, they found the money and they have laptops for all the students.
Oh, that's great. That's
Wow,
wonderful.
that's awesome. But
Unbelievable.
I'll underline the miraculous part.
It's before they had no money, okay?
Yeah, but they found
Exactly.
it. They found it. Now, what about the internet part? Because not everybody has internet service.
So a couple of cable networks are providing free internet during the crisis.
Oh, that's wonderful, Miss Brown. That is so rewarding for the kids, and I know it's a different change for you. How did the children respond? What's their take?
Well, my first day of teaching online will be Monday,
Okay.
so I will find out. But it's been, oh God, it's been a real hard week because I just had a week just to get all of my classes online and I'm still working on it. I just needed to take a break.
Okay. Do you think that it's possible that this could be a new way of life?
um, I I think that it's plausible, but I can't imagine parents. I mean, I feel, you feel bad for the kids. I feel bad for the parents because if they behave like they behave at school,
Uh huh.
Right. Yes.
then, and then and then the behaviors that they have that the parents will actually get to see alive and in person. That's going to be the interesting part. So I can see that eventually there's going to definitely be a shift in education. That's inevitable. Things have to change. But how quickly it's going to happen? Well, this happened quickly. So how effective will we be? I'm not really sure.
Okay.
Mhm.
Right now, Glenn, I would like to take the time to thank our sponsors, TMT. Oh, yeah, TMT, or is it TMI? TMI and partners. And if you need to contact them, you can contact them at 917-204-1658. And the gentleman that you would need to speak to is Mr. Alvin Hartley, and he helps with business plans. He helps keep businesses going. So if you have an interest in keeping your business going or need any type of information, please contact Mr. Alvin Hartley at TMI and Partners. And I also would like to say thank you to Queens Chronicle, who we're in partnership with. And hopefully, if you need ads to be put into the Queens Chronicle, you can reach Ree at 718-699-0628. And that's the Queens Chronicle. And I also want to give a shout out to Cheryl Wills from Channel 1 Anchor. She's also doing her show from home. So I wish you the best of luck and the best of health for you and your family. And Glenn, let's continue this conversation.
Yes, we've been joined by another listener, 404932. Would you identify yourself, please?
It's Petals Gowie.
Welcome, Pedal. And how are you and your family doing?
Oh, we're doing fine. Thank you for asking.
Okay.
Welcome to our world. How has the virus affected your lifestyle?
Pedal.
Oh, I'm sorry. I put myself back on mute. Well, I'm one of the essential workers, so I am out taking care of the elderly, and so it's just it's actually been very there's some aspect of this, some fear, there's knowing that I have to be out there. Not that I really want to be, but I am. I have elderly parents at home. So I'm really just trying to, take care of them, take care of myself, take care of those that I have to take care of, and just trust in God, So being at home, when I'm at home, it's fine because I actually need the rest just from being out there.
Yeah. Now, you said that what population do you work with?
I work with seniors, mostly people who have dementia, and so I am now working in the home, for longer periods of time with an elder client who could not do daycare.
Okay.
Daycare.
So that I know is very necessary to help them with their daily needs, I take it.
Yes. And given that the family also is working, it makes a huge difference, for them not to have to try to take care of their work and take care of their mom. She needs the support, and they need the support. Mm-hmm. So I'm grateful.
Are you afraid of, like, when you go out in public and then you have to return to your home?
To my parents.
Yes.
Well, my parents, we have two two providers for them that comes in and out of the home. And so I'm concerned about that. When I come home, I strip. Mm-hmm. I go in the basement, I strip, and I take a shower in the bathroom there. I change my clothes. I come upstairs and I do whatever it is that I see to do to make sure that I'm not bringing anything in the home.
Okay.
And, that I'm cleaning everything down.
So that would be your advice to people that are home attendants, visiting nurses, and so forth and so forth.
Yes, I would. Yeah, definitely. Take care of yourselves, and definitely change your clothes and take a shower, and wipe down everything. And there's some other things that I've been doing too. So I actually put vinegar in a little bit of water, like 2 cups of vinegar in
Yes.
the water. I put that on the stove, and I let that go throughout the house because that will help to clear anything that's in the air. So I just do whatever, spirits say to do. Whatever comes into my space to do, I take that on.
Well, I wish you and your family the best, and hopefully we all can get through this, hopefully in a timely fashion, you know.
Yes, I pray that for sure.
I
I pray
will,
that for sure.
since you're in the healthcare field, I wanted to ask you something. Uh, does the virus, how long does the virus, have you heard, live on surfaces?
There are many. So days, I think it's like 3 to 5 days for plastic and for metal. It's I think it's like 10 minutes on your hands, but a lot could happen in 10 minutes, with their faces. And I'm just trying to think. There are many things that I read about it. Okay,
Okay.
that so I can't really think of everything right now, but those are the two things. And then the other thing is to actually not to bring anything, like when you go to stores, not to bring those things in the house. Leave them outside for a time, and if you have to, you know, take those, if it's bleach or whatever that we use to wipe that down with it, so that we're not bringing that into the house. And I saw actually a video of a gentleman actually a doctor talking about it. And
Okay.
he said that have a clean spot on your counter,
Mm-hmm.
clean your entire counter, have a clean spot on your counter, put your bags on one side, take out and your clean all your items with an approved cleanser that would actually, kill the virus, and put them on the other side. Take, if you have cereal, take the cereal bags out of the box and throw the box away. Like really begin to think of the things that we can do to actually keep ourselves safe and keep our family safe,
Safe.
as we're moving it out.
That's very interesting. Glenn, what is your take on? I don't think that a lot of people, I think they have half the information as far as to, make sure they don't catch the virus, because I've been seeing a lot of things, in the neighborhood that's
Well,
been going on that, some of it adds up and some of it doesn't add up.
well, yeah, I would tend to agree with you. There's still not enough known about the virus. Um, Most people are saying at this point in time that it's not airborne. Um, Yet they're still not real clear about it. However, that being said, um, we have to take the precautions that we need to take to keep ourselves safe. And you're right there. You know, I've seen guys still on the street passing joints.
Right.
I've seen people still engaging in handshakes and so forth. Um, um, I think you were telling me something about somebody that had a mask on.
Yes, I was telling you that I had went into the supermarket down the block from me, and I ran into three firefighters, and they had their uniform on. They didn't have any mask on, and they had no gloves, and they were picking up items off the shelves, putting it into the shopping cart, and people next to them, some people had on a glove, some people had on the mask. So it was like, if you don't have on your gloves and you pick up something that maybe somebody has a virus, but you was trying to be cautious because you had on your gloves and your mask, but what about the shopping cart? What about, when you put your food down on the cash register? And then what happens that when you bring the food now in your house that has been on those surfaces, what are the consequences?
Well, again, we've got to keep safe. We've got to be mindful of it. We have to take the social distancing. I walked through a park a couple days ago, and people were still playing basketball and playing handball because it was a nice day out, and playing soccer. So people really haven't gotten the message that we're trying to contain this thing and reduce. I think I've got to say that I am. I like how the governor has took leadership and decided to do some things. Don't agree with everything, but I do understand where he's looking from and what he's doing. And quite frankly, he's demonstrated more leadership than the federal government, in my estimation, and as well
I
as
agree.
yeah,
Mhm.
as well as De Blasio as well. I mean, they've been pretty much in sync, but there's still been some things to do, and the bottom line is is for me. Let me speak for myself. I'm not a medical expert. I'm not even in that field. But the thing that um, would be the most detrimental, and I think Governor Cuomo has spoken to it, is that when people get sick, the healthcare facilities can't accommodate all the people if we're not slowing down the curve of the sickness and of the virus. Um, I know people like Pedal who are frontliners. I'm on the board of directors for Joseph P. Adopt Family Health Center, and people are calling in sick. They're catching the virus. They're minimizing the staff. So the healthcare workers are really on the front line. They don't have enough equipment. Um, they're having to use masks all day, which is something that they would never do in a normal circumstance.
No,
Uh,
because I mean, I've worked in hospitals for many years, and one of the things is once you put your mask on and your gloves, and you finish with that patient, you take it off and then you throw it away and you wash your hands and then you put on a new set of gloves and a mask to go to the next patient.
right, and they can't do that. They're not able to do that because they don't have the supplies. And 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 here's the insidiousness of all of this. People are coming in to the hospitals and the healthcare facilities and stealing toilet paper and hand sanitizer.
That is just very distasteful.
It's disturbing, and it happens. I mean, not everybody's doing that, but I mean, it's just we're in such of a panic that I think that how we're operating is not graceful. Certainly, is not um, uh, with humble and humanity and what have you in mind. Um, and so I think really that's the message for us inside of this shut-in state is for us to really get our minds together. There's really an opportunity for us um, to to engage with our maker, be it God, Allah, Buddha, Jehovah, whoever your higher power is that you believe in. It's an opportunity for us for me to get with God, for me to really get clear who I'm sourced by and who has the real power. Because there's a lot of stuff floating out there, idols, and people have idolized their cars and their phones and the television and being a star and being this and that, Um, and for me, I think that some of us have forgotten our basics. You know, having family dinners. Sitting around the table without the cell phone in our face, engaging in conversation back and forth.
Yeah, this helps bring family back together, but it also can tear family apart because we have a lot of families. I don't mean to laugh, but we do have a lot of families that have domestic violence issues, and the only way that they can escape their partner or whoever is the person is by leaving the house and going to work or even just sitting down in Starbucks, to get some type of relief. And now you're just cooped up, you're right on top of each other. So I'm very concerned for the people that have mental illness, and I don't think that they're being addressed as much as they should be addressed. And where do they go if they really need to escape?
Well, you've gotten there's a twofold in that, because I don't think as a society that we've really addressed mental health the way we should, from an agency standpoint, from a family standpoint, from a societal standpoint, in terms of getting people what they need. So that's one factor, and certainly if you've got Alzheimer's or something that you don't remember, you're not gonna wash your hands
No.
every time. You're not gonna keep your hands away from your face. You're not gonna put on the gloves if you don't remember and or dealing with the public, what have you. So I mean, and even for the people on the front line, sometimes you forget. We're
True.
so used to operating. It took me at least 4 or 5 days to get used not to reaching out to shake somebody's hand.
Hand. Yeah.
I mean, because that's what I do automatically. That's something that, and so having to hold that back, we're who we are people who engage with each other, you know. Um,
Yeah, it's a natural thing to shake somebody's hand or embrace your friends or your family by a hug or a kiss. And then now you have to say, oh, okay. Uh, Hi. It's kind of impersonal, or, you do the
yeah.
elbow thing now.
Well,
Uh,
I want to hear from a couple of our listeners. So,
okay.
what are you guys going through? Let's hear from you guys. What are you engaged in? What are you up against inside of this virus?
Okay. Good. This is Baron here. By profession, I'm a licensed practical nurse, but I retired in 2015. You understand what I'm saying? And then I got into this financial education business that I'm involved in right now.
Right.
And I just got a letter from the mayor's office uh, asking me to come out of retirement to help this what you call it medication, the med surge. It was termed, you know. And as much as I would have liked to have done that, I can't because this person is 65 years old and I have diabetes.
Okay.
And so I cannot participate. If I do, I'm at risk, really at risk.
Yeah.
So if I should participate in that, and I should happen to come down with the coronavirus, the first thing anybody's gonna say is, "Well, look, he knew he was 65. He knew he had diabetes. Why did you participate in this if you knew you were susceptible? If you was in that category of people who are susceptible?" So it's kind of bothered me that I couldn't contribute because when you are a nurse, you are a people person. You
Correct.
understand what I'm saying?
Yeah.
I mean, some people into the profession for the money, and some people into the profession because they're people person and the money. I mean, you get paid fairly well. You
Yes.
know. Now,
Hmm.
my mother is 84 years old, and we have to be very careful. I heard you talk about bringing groceries in. You know something? When I brought some groceries into the house, before I even brought them into the house, I always kept alcohol in my car. I always kept alcohol in my car because if I'm out in the street and I order something from one of these fast food places, I had no place to wash my hands, but if I had the alcohol in my car, I could just squirt some alcohol in my hand, wash my hand, and dry it off. Because
Right.
I kept paper towels in the car too as well. You see what I'm saying?
Mm-hmm.
So what I found myself doing is when I would take, because we shop at Costco a lot. Not that I'm promoting Costco. So what I would find myself doing is when I was taking stuff out of the car, I was wiping them down before I would transfer them into a bag.
Okay,
Okay.
that's wonderful.
Before I even got them upstairs. You understand what I'm saying?
Mm-hmm.
Now when you get them upstairs, now you take the cereal out the box and throw the box away. But before I even took them out the car, while they were still in the containers, I was wiping the containers down.
Yeah. Yes.
I came from the health food store the other day, right? And again, all right, I had two plastic bags here. One plastic bag wasn't used, so I wet down my paper towels, and then I was taking my vitamins out. I was wiping the bottles down before I even got them upstairs.
Okay.
Okay.
Okay, all right, and also too, we have always been in the process of wiping down the doorknobs after you come in. The first thing we do is go straight to the bathroom to wash our hands. Okay, and even inside the house, we wipe down the doorknobs, the door handles, the refrigerator handles, the knobs to the stove, all of that. The knob to the toilet, the part that you flush,
Right.
the door handles to that. The knobs, the hot cold water knobs. You know what I'm saying? We would wipe down that all. We was doing that before all of this. You know, and so like now, it's becoming something that's more conscious, even though I had already been conscious of it. You know.
Well,
I mean, let me just say, yeah, go ahead.
since I have a nurse on the line, I wanted to ask you: do you think that this is airborne, or what's your personal take on how people can contract this?
Well, if you mean airborne in the sense that if I walk into a room and I had coronavirus, if I sneeze or breathe out into that room, it may be airborne in that sense. That anybody possibly who's in that room who's within whatever amount of distance it is might end up becoming infected. I don't believe that it's airborne as far as being out in the air concerned, because if you watch these politicians and these other people, they don't have masks on when they come out in public.
No,
They do
don't.
maintain a distance between each other. So, no, I mean, it's not my opinion now. But when you observe them, you see them, they don't have the mask on. But they would be, if they were in a room with each other, they may maintain some distance between each other. So they may be airborne in the sense of being in a contained environment.
Okay.
You know? But as a nurse, I've been hearing some terrible stories. And I don't want to say what I heard because I don't want to panic anybody. But I have been hearing stories about certain types of pain relievers that contribute to the potentiality of the coronavirus.
I heard those stories too. I did.
That you shouldn't be taking. And I don't know how true they are, but you know something? I never did like ibuprofen anyway. You know what I'm saying?
It's bad for your stomach, though. You know, especially if you take it very often. I know that. Yeah, but
and then from a medical point of view, I heard read from someone sent me something from CNN or something that in Wuhan, China, right?
Right.
In the city of Wuhan, in China, that one of the reasons why those people have slowed the virus down is because there was a natural ingredient in tea, that the caffeine, and there's another ingredient that's naturally in tea that inhibits the coronavirus ability to infect this host. Okay.
Wow.
Now I don't know if you heard this.
No, I didn't hear that part.
Also, yeah, and that they have been serving the population tea 3 times a day. I don't know how true that is.
Yes.
But if it wouldn't hurt anyway, because I slice up a slice of lemon, I throw some apple cider vinegar in my tea anyway.
Mm-hmm.
So it's not gonna hurt. I mean, you can overdo anything.
True.
You know, but 3 times a day, 8-ounce cup of tea 3 times a day, that's not gonna hurt too much. You know, and I heard that also vitamin C, 2,000 to 3,000 milligrams a day. Vitamin C is a water-soluble vitamin. You don't retain it. It comes out in your urine.
Mm-hmm.
Okay? I also read that zinc, selenium, and magnesium are also good. You get to watch the doses on that zinc because people can take anything and overdo it.
True.
And if you do things in moderation, but you're looking for effect, but you don't want to go overboard with it, it won't hurt anything. All right. As a 65-year-old, I'm supposed to be taking my vitamin supplements anyway. All right. All
Well,
right. And if you're
Lionel,
not 65,
yeah.
yeah.
Well, what you're pointing to, and I think it's for some of us we're learning about building up our immune systems. That's something that we should know about anyway, and should be practicing, because the immune system is how anything gets into our system, be it virus or germ, and so some of those things that you're talking about are really inside of that immune system. Um, Before we continue, back to you, Pauline. You want to do a commercial break?
Yes, I also want to talk about our other sponsor, Mr. Stephen E. James, attorney at law, attorney at war, and he hasn't lost a case in the last 30 years. He is located at 87-66 Southern Boulevard in Jamaica, and his number is 646-905-9000. And of course, I would like everybody to remember that you can hear our show on Spotify, iTunes, iHeartRadio, CBTV radio, and television, which is called Caribbean Buzz. We're also on Roku, and also follow us on Facebook and Instagram and our YouTube channel, which is Our World. So I know that was a lot to digest, but but
And
if
Apple TV.
oh yes, and Apple TV. You're absolutely right. Apple TV. I always forget about Apple TV. The most important thing is I'm trying to get out a message to the people here in Queens, because we're having a big problem in Elmhurst, and I have two places that I live, and one is in Left Rock City, and another place over here in Jamaica, Queens, and I'm very concerned for what's going on over there about the people that are standing online just to get into the hospital, and it's very scary, you know.
I think that the Elmhurst situation is a kind of a tipping point. It's really showing us when the system breaks, here's what it looks like. So we're getting a preview, and hopefully people are seeing that and understanding in the rest of the country, because I think there are other parts of the country that are not taking this as serious as California is, and ourselves. And there are other states that are in, of course, New Jersey and Connecticut. But I think that those four states specifically have really taken leadership in terms of squelching the inevitable.
Have you had any? I know you're out in the community and you're a community person. Um, have you heard anything like people wanting to get tested and not knowing where to go to get that type of service?
Well, I'm getting briefed quite a bit from Joseph P. Adabo Family Health Center. We had a meeting just this past Wednesday, and one of the criteria again is because they don't have enough testing units, testing equipment, they're restricting who gets tested. So you have to go through a series of questions. You have to, are you dealing with any symptoms? Are you got a compromised system, pre-existing, condition that would, and that you're having symptoms. At that point, they're actually testing people. However, the tests, I've heard tests take as little as 24 hours, but it can take up to 72 hours. So even when you get tested, you don't get the feedback right away. You don't know, where to go or what to do. And quite frankly, I think more people have it than than the count is because we haven't had the testing units. So testing is not available to everybody. You need an appointment, and you've got to. And before they'll test you, you have to have some conditions inside of it. So it's still very restricted because we don't have the test items, and again, we don't have all of the equipment for the frontline medical staff to even protect themselves. So it's getting a little dicey. Um, but again, if we do the right thing, and to for me, it's really the love of God. You know, that's my source, and that's my you know um, my keeper, and he's also taught me to be smart. So I'm not just relying on that. He's given me free will, and so inside of the free will, I have to do the right things. Wipe my hands, cover my face, cough into my elbow.
Right.
Just general things. Um, and what's amazing to me is you have people that prior to this use the bathroom and don't wash their
Wash their
hands and
hands.
just walk out. And I mean, I'm not a germaphobe, but I realize that I don't touch no handles walking out the bathroom with my bare hands.
I
Okay,
hear you, Glad.
um, you know, I wash dry and then I look for something to touch between my hands and the handle going out. So I mean, so these are just common, you know, cleanliness kinds of things that they're really working towards and have an opportunity just to take advantage of. I want to hear from Michelle Sonora in terms of how are you dealing. What's your mindset in terms inside of this virus that we're dealing with?
Well, this is Michelle. I'm being very cautious because as a kid and up to adulthood, I suffered with bronchial asthma. So, it was like every summer I would get, even up to like last year, get a respiratory infection.
Oh,
So
well,
I'm changing, when I do by going to the health store and buying the different things like the eucalyptus oils, the different essential oils, and up my intake of garlic and onions and warm teas and whatnot. And now, my daughter is a transit worker, so I have had to drive her in to work. And I've noticed, you know, she sent me a picture in the crew room with there's so many transit workers that are sitting down close together
yeah,
Yeah.
without any PPEs, and that's been a little alarming for me. So before she gets in the car, I have to spray it down when she gets back. When she gets home, I ask her to take her stuff off, like the young lady said earlier, spray down. I have to wash her stuff today. And I've seen people do things. I only go out. I go to the grocery stores, and I still, like you said, people are still not taking it serious.
No.
Still not being very hygienic. Yes, I went into a Home Depot to get some more bleach, and a gentleman had and I have to applaud Home Depot because they're letting only like 5 or 6 people at a time. They have already marked the one on Merrick. They have marked, 6 feet spaces so people don't be on top of each
Oh,
other.
they did. That was interesting. Okay, so
good.
they are trying to follow the guidelines.
Right. They have already cordoned off. You have to get into the line. They marked it. But you have people, there was a man by the light bulbs and he had a mask on, but it was on top of his head and he was coughing. And he
Oh
had an
goodness.
air, and it made no sense to me. Like, what is it that you don't understand?
Correct.
Or you see people still taking the shopping carts, and I've said, "Excuse me, you're not concerned? Oh, I got the sanitize in my car, or and I'm like, wow. So if everyone is not on board to do this, it's going to just slow down. Like they said, flatten the curve. I mean, the curve can be flattened real a lot earlier if everyone will adhere to what they hear the governor and the mayor and health care workers telling them. Because if they're dying, what makes us think we're not going to be infected? You see,
Correct.
so I am concerned with myself. So I pretty much stay in. I've been again reading, listening, and praying a lot too.
Yeah.
Because I think, as the gentleman said, I think it was you, Glenn. You said it was, um, well, lack of a better word, to be ethnic cleansing every century or so. Things happen because we are in a dense population right now, and no one gets checked before they get here, and so you can't blame any particular area, people where they're coming from. But we do know that we need to do a better job in vetting people, you know, and the food that we get, it needs to be vetted better. But under this administration, I fear that it won't get any better. So we have to stay prayerful, and hopefully we can, something like this, we can get into have a prayer, because as the prayers go up, the blessings come down. So we
If
have to be
you're
very
if you're
vigilant.
not speaking, please put yourself on mute.
We have to be very vigilant in prayers. We have to be very prayerful right now for the children, the everybody.
Yes.
Everybody has to. So I do call people, and especially the seniors, make sure that they're okay. If they need anything, as much as I can do. And it's good that we're contacting each other, say that we're still up and moving.
Now, Glenn, I know you work with the seniors, and I know you're with Grace Church here in Queens. Tell me, how are they doing? Do they have enough food? And how are the seniors getting around if they have to go to medical appointments and so forth?
Well, we have the Grace houses, and as far as I know, their food is being delivered, so they get care packages um, once a week from other places. We also have a food pantry at Grace Church that we also supply food. We're not cooking these days since we've been shut down. So they've been getting food, and as far as doctor's appointments, a lot of folks are not even going to the doctor for routine treatment.
But
Uh,
Glenn,
you
I'm
know, part
sorry.
part of the sanction is that any elected operations and so forth have been postponed or canceled, but that's between the patient and the doctor more so than somebody overseeing. And if they've got symptoms or not feeling well, of course, they're going to go to their emergency room. So again, the emergency rooms are dealing with the virus as well as anybody else who's having challenges, because people are still having heart attacks
Tax.
and whatever, what have you, that would have you go to the hospital. So so you've got that on top of everything else that's going on. So again, I my hand goes out to the medical staff for what they're doing inside of not enough supplies, inside of um, getting could be getting the virus themselves as well. So
Uh,
it's challenging.
And I also wanted to let people know that this is the allergy season, and people do have allergies, and sometimes they do mimic a cold with sneezing and coughing, and you could also run a temperature through that as well. So, is Walgreens open over here in Jamaica, Queens, Glenn?
Um, I know the right. Yes, Walgreens is open. Yes,
And Rite Aid?
Rite Aid is open. On Walgreens is open. Well, actually, Rite Aid is now part of Walgreens.
That's
It's
true.
taken over by Walgreens. So I know the one on Suffolk Boulevard in my district is open. I'm not sure about the one on Jamaica Avenue.
Okay, because people have to also pick up their prescriptions
Prescriptions, right,
and so forth for other medications that they need for other illnesses.
right. And I know the CVS is open on Hillside,
Okay.
um, in Richmond Hill. So the pharmacies are required to open a lot of. By the way, if you're still looking for different kinds of things, thermometers and what have you, check out the smaller pharmacies because the big pharmacies are all out. Um, but I was able to get a thermometer and I actually I overpaid for it, but got a bottle of Lysol, the spray can,
Hmm.
and was able to get that at a smaller pharmacy after going to two other pharmacies, bigger pharmacies, and they had nothing. And again, so don't omit the smaller pharmacies because they may still have uh, what you're looking for. We've got another caller, 917 589.
That's me. Hi, it's Rosa Waldron from Brooklyn.
Okay. Hey,
Hi,
Rosa.
Rosa.
Welcome
Rosa.
to our Zoom session.
Hey, thanks for doing this.
You
Um,
and how are you? How are you faring in the virus where you're at?
well, I'm one that's prone to allergies and bronchitis and asthma. So, fortunately, I'm okay overall. I
Mhm.
mean, there are times when I get the usual stuff that I normally would get, and I think, okay, is this it?
Yeah, I
and
know.
then it clears up. But usually, I try to make it a point to take a walk outside. Well, where I live, there are houses, and then at the end of the block or the next block over, then there are apartment buildings. So we're kind of spread out enough for me to take a walk around
Okay.
and not have to deal with an elevator or anything like that. Stairs, yes, but not an elevator. Um, so usually every day I take a walk to, clear my lungs and all that, especially since um, my landlord had some the contractor here recently to fix a hole a hole in the well, not the roof itself, but where the roof meets the side, whatever that's called,
Yeah.
and um, there might be a little squirrel that made its home there somewhere
Yeah.
in one part of the house, unfortunately.
Okay.
So there was some with old houses, there was a bit of dust up too, so that was another thing to
Yeah,
try to
well,
avoid.
me and you have the same thing because I have asthma and respiratory problems. So like this, ordinarily, I will feel this time of year I may sneeze or cough, or even get even a mild sore throat or so forth, and feel a little achy. But I know that it's because of the spring and the trees are starting to blossom. But then in the back of your head now, you're wondering, oh, I wonder, is that really what I have? So
hmm
I
Fortunately, I don't have aches. When you ache, are you talking about your joints or your muscles?
no, sometimes I feel like like when you feel like you're coming down with a cold and you feel achy and stuff like that. Sometimes I go through that in the early stages of the allergy season. I will
Oh,
feel that way. Yeah.
right.
Yeah, I've always
Well,
suffered very bad from when springtime comes or even in the fall, but I know what it is.
hmm
But these days sometimes you can get it confused. So I'm just hoping that people are staying vigilant about the symptoms that they have, and if you do start to run a high fever, that it's not coming from allergies.
right. And I always try to knock it off, like nip it in the bud. Even though more than likely it's an allergy, I'll take my teas or echinacea or whatever,
Uh-huh.
and some extra C. Um, Now, there was, oh, COVID. Okay. So it sounds like, sister, you're calling from Queens, right?
Yes, I am calling. I'm in
Oh,
Queens.
what's your name?
My name is Lady Pauline.
Nady?
Lady
Lady
Pauline.
Pauline, we're co-hosts.
Oh, okay, hi. Since you're part of New York, I don't know if you signed up for the Notify NYC app. That way you can get notices from the city, legitimate stores, and they can tell you, like, for example, when Glenn mentioned he overpaid for the thing that he got,
The Lysol.
there, the Lysol, they're doing, the city's doing work to stop that and investigate who's doing that. If you need that number, what you would do is text COVID,
And it's 962
COVID. Yeah.
962.
Uh, it might be.
Yeah, I'm pretty sure that's it.
Okay.
So that's how you can get notified. And they give regular text messages just to give you, as Rosa said, an update on what's going
Yes.
on. And it's just to keep track. And I actually watch Governor Cuomo's press conference, not every day, because I can't watch all that stuff all the
No.
time. It's you, you can get depressed very easily if you just listen to the news and watch everything about it, because it's like, you know, and I get that what they're trying to do is to alert people and make sure that people are aware and are vigilant. But for myself, I have to step back, and like I said, I'm doing the Course in Miracles. So I'll read the text for that, or look at my lesson for the day, and so forth, and to kind of do my own spiritual work to just shore up myself, and make sure that I've got my mind in the right space so that I can actually do what I need to do. I know we're about out of time. I wanted to hear
Yes.
from Sonora before we ended the session. Sonora, anything you want to share around what you're dealing with, and what's working for you and what's not working for you
Um,
around
I
this?
think the hardest thing for me is, resisting the urge to go out, because I'm usually in and out a lot. And it's hard, because I'll think, oh, I need this, one thing. So now what I've started doing is making a list. So if I do have to go out, I'm more strategic about not just running out for one thing. And I know it's just to get out and do something different. What I can say through all of this is that it has given me time to do things that I said, oh, if I only had more time. Well, now I do have more time. So I'm realizing that I'm really appreciating the quiet and just the time to do things like you said. I'm a very spiritual person, so just more time to spend reading the word, spend time meditating, and just more time just reflecting and uh, you know trying to figure out like what my next moves are going to be. Like this is going to end, and I'm thinking, okay, when this is all over, you need to have a plan about what you're going to do, because you can't go back to what you were doing. So I kind of appreciate it as a teacher. I tell the kids, don't do this, don't do that, and then some of those same things you recognize in yourself. So it's been a good time for me.
Well, that's good. I
Great.
want I want to say thank you to everybody that has participated in Our World, Our Power podcast. My co-host, Mr. Glenn Greenwich. Do you have a number that people want to reach you at, or
Yeah, folks can reach me at 718-291-2110, or at 929-310-4281. So
okay?
those are my main numbers. I want to say God bless. Keep yourself safe. Be vigilant. Do what you know to do.
Okay. Uh,
Thank you.
thank you,
Yes. Thank you
Thank
all.
you.
Thank
and
you.
Take
thank
care.
Thank
you.
you.
Catch you
And
all
Take
we'll
care of
be
yourself.
catch you all
yes,
next week at the same time, same
and we'll be
place.
on Zoom
Zoom.
until otherwise, and then we'll
Advice.
be back on the radio and Caribbean Buzz.
Buzz.
And you could look for the FaceTime Live that we do, as well as all the other spots where we can be reached at.
Reached it. Yeah.
This is on the radio right now?
No, not this, not this session, but we put it it's put on YouTube. We're put on other venues to
Venues.
just
It goes on Spotify, iTunes, TuneIn, and Google Play at a later date. That's how it's done.
Okay.
So you can listen
And I
to the
have a
show.
request then when because you were about to say my number the whole time, my entire
I didn't
number.
give you a whole
No,
number. I
you
didn't give
could
you a
just
whole
say
number.
who just joined the call.
Right, but I didn't give you a whole number. I only gave it
Okay.
up to the first 6 digits.
Well, that's pretty far, but okay. Thank you. Yeah, it might be best if you don't mind just saying who just joined the call, and unless it's more of us, but usually that works
Okay.
if you don't mind.
All right.
Okay, thank you so much.
Thank you.
Take care,
Thanks.
everybody.
All right.
Peace and blessings.
Okay.
Yeah. God bless everybody and
Yes.
stay healthy. Glenn, I
You too.
will talk to you. Thank you for hosting with us again on Our World, Our World Power. Take care.